Maya Bennett moved through Memorial General Hospital's emergency department like a shadow, quiet, efficient, and completely invisible to those who mattered. At 34, she had perfected the art of being overlooked. Her dark hair was always pulled back in a neat ponytail, her navy blue scrubs were pressed to perfection, and her brown eyes rarely lingered on anyone's face long enough to be remembered. The doctors called her the quiet one when they bothered to acknowledge her at all, though most treated her like a piece of hospital equipment, useful when needed, forgotten otherwise. Before we jump back in, tell us where you're tuning in from. And if this story touches you, make sure you're subscribed, because tomorrow, I've saved something extra special for you. Maya had been working at Memorial General for 8 months now, having taken the nursing position after what she told everyone was a career change. She'd moved to Chicago from nowhere in particular, with references that checked out but a background that somehow felt deliberately vague. Her supervisor, head nurse Linda Carson, had been impressed enough with her credentials to hire her on the spot, though she'd noted something in Maya's demeanor during the interview, a certain steadiness under pressure that seemed unusual for someone with her stated experience level. The emergency department at Memorial General was a war zone on the best of days. Located in downtown Chicago, it served everything from routine medical emergencies to the city's most traumatic cases: gang violence, car accidents, industrial incidents, and the constant stream of humanity that flowed through one of the busiest trauma centers in the Midwest. It was the kind of place that chewed up inexperienced medical personnel and spit them out within months. Yet Maya had adapted to the chaos with an ease that surprised even the veteran nurses. She worked the night shift, 7 p.m. to 7 a.m., which meant dealing with the worst cases when the hospital was understaffed and resources were stretched thin. While other nurses complained about the difficulty of overnight emergency work, Maya seemed to thrive in the controlled chaos. She anticipated needs before they arose, moved through the department with purposeful efficiency, and handled the most difficult patients with a calm that bordered on supernatural. Dr. Connor Walsh had noticed Maya's competence, though not in the way she might have hoped. Walsh was the emergency department's newest attending physician, a 29-year-old hotshot who'd graduated from Northwestern Medical School and believed his MD automatically made him the smartest person in any room. He'd completed his residency at a prestigious hospital in Boston and came to Memorial General with recommendations that praised his technical skills while diplomatically avoiding mention of his interpersonal abilities. From his first week at Memorial General, Walsh had made it clear that he viewed nurses as support staff, whose primary function was to follow his orders without question. He was particularly dismissive of Maya, perhaps because her quiet competence somehow threatened his need to be the center of attention during every medical crisis. Where other doctors appreciated her efficiency, Walsh saw insubordination. Where they valued her calm under pressure, he interpreted silence as incompetence. Bennett, Walsh would bark when he needed something, never bothering with courtesy or acknowledgement of her name. "Get me those labs now." His tone carried the kind of condescension that made other nurses uncomfortable, but Maya endured it with the same steady professionalism she applied to everything else. She'd learned long ago that some battles weren't worth fighting, especially when you had bigger secrets to protect. Maya's apartment, a modest one-bedroom unit 15 minutes from the hospital, reflected her carefully constructed ordinary life. Medical textbooks lined one shelf, a few photographs of family members sat on the mantel, and everything was arranged with the kind of precise organization that spoke to habits developed under pressure. But hidden in her bedroom closet, wrapped in a military-issued duffel bag she rarely opened, were items that told a very different story about who Maya Bennett really was. Inside that bag were her military dress blues, worn but meticulously maintained, a collection of commendations and medals, including a Bronze Star with V device for valor and a Purple Heart from her second deployment, her military medical kit, custom modified over years of field use, containing instruments and supplies that went far beyond basic battlefield medicine. Most telling of all were the photographs Maya, in desert camouflage, standing outside field hospitals in Afghanistan, surrounded by fellow medical personnel who looked at her with the kind of respect reserved for those who'd proven themselves. Under the worst possible conditions, Maya had spent 6 years as a combat medical officer in the Army, serving 2 tours in Afghanistan and 1 in Iraq. She hadn't just been a medic, she'd been a field surgeon, qualified to perform complex procedures in conditions that would challenge doctors in the best-equipped civilian hospitals. She'd operated in bombed-out buildings while under enemy fire, performed emergency surgery in the back of moving vehicles, and saved lives using improvised equipment when proper medical supplies weren't available. Her military service had ended 3 years ago, not because of injury or incompetence, but because of loss. Captain James Bennett, no relation, despite the shared surname, had been her partner in both war and life. He'd been killed by an IED while accompanying a convoy she was supposed to be on. A twist of duty assignments that left Maya alive and drowning in survivor's guilt that no amount of therapy seemed to touch. After James's funeral, Maya had tried to continue her military service, but every emergency evacuation, every wounded soldier, every desperate attempt to save a life reminded her of what she'd lost. She'd completed her enlistment and left the Army with full honors, but also with a determination to find a way to serve that didn't constantly reopen wounds that refused to heal. Civilian nursing had seemed like the perfect solution. She could use her medical training to help people without the constant threat of violence, the ever-present danger that had defined her military years. She'd deliberately taken a position that underutilized her skills, content to be overlooked if it meant avoiding the spotlight that came with recognition. That Maya had chosen Memorial General, specifically because it was large enough for her to blend in, busy enough that no one would ask too many probing questions about her background, and challenging enough to keep her skills sharp without requiring her to reveal the full extent of her capabilities. She could handle trauma cases, assist with procedures, and make a difference in people's lives without anyone expecting her to be anything more than a competent nurse. The irony wasn't lost on her that she'd ended up in another war zone, just one with different uniforms and different weapons. The emergency department's controlled chaos was familiar in ways that civilian hospitals weren't, and she found herself drawing on military training more often than she'd expected. The ability to stay calm under pressure, to make quick decisions with incomplete information, to work efficiently in high-stress situations, all skills honed in combat served her well in emergency medicine. But Maya had also inherited something else from her military service, a deep understanding of the cost of violence, of trauma, of the kind of injuries that changed lives forever. She approached each patient with a compassion informed by experience, knowing what it felt like to be wounded, to be afraid, to depend on the skill and dedication of medical personnel for survival. What none of her colleagues at Memorial General knew, what none of them could have guessed, was that the quiet nurse who efficiently handled their routine emergencies was one of the most qualified trauma surgeons they'd ever worked alongside. Maya had performed procedures in Afghanistan that most civilian doctors would never encounter in their entire careers. She'd saved lives under conditions that would terrify even the most experienced emergency physicians. Every day, Maya watched doctors like Walsh struggle with cases that would have been routine for her in the field. She bit her tongue when she saw inefficient procedures, outdated techniques, approaches that worked in textbooks but fell apart under real pressure. She could have shared knowledge that might save lives, techniques that might reduce recovery times, insights that came from operating at the absolute edge of what was medically possible. But revealing that knowledge would mean revealing herself. And Maya wasn't ready for that kind of attention. She was content to be the invisible nurse, the reliable support staff, the one who anticipated needs and handled crises with competence that seemed to come naturally. It was a role that allowed her to serve without standing out, to help without having to explain why she was qualified to help. As she finished her shift that particular morning, organizing her station with the methodical precision that had become her trademark, Maya had no idea that her carefully constructed anonymity was about to be shattered. She was about to face a crisis that would demand every skill she'd learned in combat, every technique she'd mastered under fire, every lesson her military service had taught her about the difference between surviving and saving lives. Dr. Connor Walsh's dismissive attitude toward just another nurse was about to collide with the reality of who Maya Bennett actually was, and the confrontation would change everything for both of them. The pattern of dismissal had started on Maya's very first week at Memorial General, though it took several days for her to recognize it as deliberate rather than coincidental. Dr. Connor Walsh had a particular way of interacting with the nursing staff that seemed designed to reinforce the hospital's hierarchy at every possible opportunity. With the male nurses, he was professionally distant but respectful. With the older female nurses, especially those with decades of experience, he maintained a grudging courtesy. But with Maya, something was different from the beginning. "Bennett, I need those vitals updated," Walsh would say, not bothering to look up from whatever chart he was reviewing. His tone carried an edge that made nearby staff uncomfortable, though none of them seemed willing to address it directly. Maya would comply with the request efficiently, professionally, but Walsh always seemed to find something to criticize about her performance afterward. "These readings don't look right," he'd announce loudly enough for other staff to hear, even when Maya's measurements were perfectly accurate. "Make sure you're using the equipment properly." The implication was clear: he didn't trust her competence, and he wanted everyone else to share his skepticism. Nurse Jennifer Kim had been the first to notice the pattern. Kim was a 5-year veteran of Memorial General's emergency department, someone who'd seen enough workplace dynamics to recognize when one staff member was being systematically undermined. She'd worked with Maya on several shifts and had nothing but respect for her colleagues' professionalism and skill. "He's got it out for you," Kim told Maya during a brief break one particularly busy night. They were standing in the hospital's small break room, sharing coffee that had been sitting on the warmer for too many hours. "Walsh, I mean. I've never seen him treat anyone else the way he treats you." Maya sipped her coffee and considered her response carefully. She'd noticed Walsh's behavior, of course, but acknowledging it would mean admitting it bothered her. And Maya had learned to internalize such treatment, rather than fight battles that might draw unwanted attention to herself. "Some people have strong opinions about how things should be done," Maya said diplomatically. "I'm still learning the way things work here." Kim shook her head. "You've been here 8 months. You know this department better than doctors who've been here longer. The way he talks to you, it's not about competence. It's about something else." What Kim couldn't have known was that Maya's military experience had given her extensive training in recognizing and handling hostile behavior from superior officers. Walsh's treatment was unprofessional and demoralizing, but it was also familiar in ways that allowed Maya to compartmentalize it rather than let it affect her performance. The broader nursing staff at Memorial General had begun to notice the dynamic as well, though their responses varied. Some, like Kim, were openly supportive of Maya and critical of Walsh's behavior. Others seemed to view it as normal workplace friction, the kind of personality conflict that inevitably arose in high-stress environments. A few appeared to take Walsh's treatment of Maya as permission to be less respectful themselves, following the lead of someone they perceived as having more authority. Dr. Alex Foster, one of the emergency department's more experienced physicians, had also observed the pattern with growing concern. Foster was old-school medical professional, someone who'd earned his position through years of dedicated service, and who still believed that hospitals function best when all staff members were treated with respect regardless of their position in the hierarchy. "Connor," Foster had said to Walsh after witnessing a particularly dismissive interaction with Maya, That nurse has been nothing but professional since she started here. Maybe ease up a little. Walsh's response had been defensive and revealing. She's competent enough, I suppose, but there's something about her that doesn't add up. Her background, the way she handles situations, it's like she's holding something back. I don't trust people who aren't completely transparent about who they are. Foster had found Walsh's reasoning unconvincing and troubling. In his experience, the best medical professionals often brought diverse backgrounds and experiences to their work, and judging someone based on perceived mysteries rather than actual performance was both unprofessional and potentially dangerous. In a medical setting, that the tension came to a head during a particularly challenging shift in late October. Memorial General was dealing with the aftermath of a multi-car accident on Lakeshore Drive, and the emergency department was operating at capacity with trauma cases that stretched their resources to the limit. Maya had been assigned to assist Walsh with a patient who'd suffered severe chest trauma, a case that required precise coordination between physician and nursing staff. Maya had anticipated Walsh's needs throughout the procedure, providing instruments and supplies before he asked for them, monitoring the patient's vital signs continuously, and maintaining the kind of calm efficiency that allowed the medical team to focus on saving the patient's life. The procedure was successful, the patient was stabilized, and the team moved on to the next emergency. But instead of acknowledging Maya's contribution, Walsh had used the high-stress situation as an opportunity to criticize her performance in front of the entire medical team. "Bennett, when I ask for a specific instrument, I need it immediately, not after you've finished whatever else you think is more important," Walsh announced as they moved away from the patient's bedside. In trauma situations, hesitation can cost lives. The criticism was not only unfair. Maya had been faster and more responsive than most nurses Walsh had worked with, but it was delivered in a way that seemed calculated to undermine her credibility with other staff members. Several nurses who'd witnessed the procedure exchanged uncomfortable glances, recognizing that Walsh's criticism didn't match what they'd observed. Maya's response was characteristic of her approach to such situations. "Understood, doctor. I'll make sure to be more responsive in the future." Her tone was professional, her demeanor calm, but those who knew her well could see the tension in her posture, the slight tightening around her eyes that suggested Walsh's behavior was having more of an impact than she was willing to show. Head Nurse Linda Carson had been observing the interaction from across the emergency department, and she'd seen enough. Carson was a 20-year veteran of hospital administration, someone who'd worked hard to maintain professional standards and mutual respect among her staff. Walsh's treatment of Maya was becoming a pattern that threatened the collaborative environment Carson had worked to build. "Dr. Walsh," Carson said, approaching the physician as Maya moved on to her next assignment, "I'd like to speak with you privately when you have a moment." The conversation that followed was brief but pointed. Carson explained that she'd been monitoring staff interactions and was concerned about the dynamic between Walsh and Maya. She emphasized that all nursing staff deserve to be treated with professional courtesy, regardless of any personal opinions Walsh might have about their backgrounds or capabilities. Walsh's response was defensive and telling. "I hold all staff to high standards. Linda, if Bennett feels like she's being treated unfairly, maybe she should consider whether she's really cut out for emergency medicine." Carson's years of experience had taught her to recognize when workplace conflicts were driven by professional concerns versus personal issues, and Walsh's attitude toward Maya clearly fell into the latter category. She made a note to document the conversation and began paying closer attention to their interactions, recognizing that the situation was likely to escalate unless addressed more directly. Meanwhile, Maya continued her work with the same steady professionalism that had characterized her performance since joining Memorial General's staff. She handled Walsh's criticism and dismissive treatment as she'd handled hostile behavior during her military service, by focusing on her mission, maintaining her standards, and refusing to let someone else's problems become her own. But underneath Her calm exterior, Maya was beginning to recognize that her strategy of maintaining anonymity and avoiding confrontation might not be sustainable in the long term. Walsh's behavior was affecting not just her own work environment, but the broader dynamics of the emergency department. Other staff members were beginning to take sides, and the tension was becoming a distraction that could potentially impact patient care. As Maya finished her shift that morning, she reflected on the conversation she'd had with Kim about Walsh's treatment and Foster's supportive comments during the trauma case. She was beginning to realize that her military experience had given her tools for handling hostile environments that her civilian colleagues lacked, but it had also given her a tolerance for unacceptable behavior that might not serve her well. In this setting, the question was whether she was prepared to stand up for herself in ways that might draw the kind of attention she'd been trying to avoid, or whether she could continue to endure Walsh's treatment while maintaining the professional standards that had always defined her approach to medicine. What Dr. Connor Walsh and the rest of Memorial General's staff didn't know, what they couldn't have known unless they had access to classified military records, was that Maya Bennett was one of the most highly trained combat surgeons the U.S. Army had ever produced. Her journey to that expertise had begun 12 years earlier, when a 22-year-old Maya had enlisted not out of patriotic fervor or family tradition, but out of a simple desire to receive the best medical training available while serving something larger than herself. Maya had grown up in a working-class family in Detroit, where her parents had struggled to make ends meet despite both holding steady jobs. College had been financially impossible, and traditional medical school was completely out of reach. The Army's medical corps had offered her a path to the career she'd dreamed of since childhood. When she'd watched emergency room doctors save her younger brother's life after a serious car accident, her initial military medical training had been comprehensive but standard combat medic certification, field trauma protocols, the kind of training that prepared soldiers to provide emergency medical care under fire. Maya had excelled in every aspect of the program, showing not just technical competence, but the kind of calm under pressure that instructors noted as exceptional, even by military standards. It was during her first deployment to Afghanistan that Maya's true potential had become apparent. She'd been assigned to a forward operating base in Helmand Province, where the combination of active combat operations and improvised explosive devices created a constant stream of casualties that challenged even experienced military medical personnel. The defining moment of Maya's military career had come during her 8th month in Afghanistan, when a convoy carrying wounded soldiers had been ambushed while attempting to reach the base's medical facility. The attack had disabled their vehicles and left 2 soldiers with life-threatening injuries in a location too dangerous for standard medical evacuation. Maya had volunteered to accompany a rescue team, bringing her medical kit and whatever surgical supplies could be quickly gathered. What she'd found was a situation that would have challenged surgeons in the best-equipped civilian hospitals: one soldier with severe abdominal trauma and internal bleeding, another with a sucking chest wound and suspected tension pneumothorax, with enemy fire continuing around them and no possibility of immediate evacuation. Maya had made a decision that would define the rest of her military career. Using the back of an armored vehicle as an operating table and working with improvised lighting, she'd performed emergency surgery on both soldiers, removing shrapnel from vital organs, repairing damaged blood vessels, and stabilizing injuries that would have been fatal without immediate intervention. The procedures had taken over 3 hours, during which Maya had worked with the kind of precision and focus that her military instructors had noted, but never seen fully demonstrated. She'd saved both soldiers' lives, and her actions had caught the attention of the Army's senior medical command. Within 6 months, Maya had been selected for advanced surgical training, a program that typically required years of military service and exceptional performance ratings. She'd spent 18 months at Walter Reed Medical Center, studying under some of the military's most experienced trauma surgeons and learning techniques that were rarely taught outside of elite medical programs. The training had been intensive and comprehensive, covering everything from complex cardiovascular procedures to neurosurgery, with particular emphasis on techniques that could be performed under field conditions with limited equipment. Maya had not only completed the program successfully, but had graduated at the top of her class, earning recognition as one of the most promising surgical candidates the program had ever produced. Her second deployment had been to Iraq, where she'd served as a field surgeon with a special operations medical unit. The work had been dangerous and demanding, requiring her to perform complex procedures in conditions that would have been unthinkable in civilian medicine. She'd operated in bombed-out buildings, in the back of moving vehicles, in field hospitals that came under attack while she was working. Maya had developed a reputation among special operations forces as the surgeon you wanted treating you if you were wounded in a place where normal medical evacuation wasn't possible. She could perform procedures that other military surgeons wouldn't attempt under field conditions, and she did so with a success rate that defied conventional medical wisdom about what was possible outside of a proper operating room. Her expertise had extended beyond surgery to include advanced trauma protocols, emergency medicine, and even some experimental techniques that were being developed specifically for battlefield conditions. Maya had been involved in research projects aimed at improving survival rates for combat casualties, contributing to medical advances that would save lives for years to come. The culmination of Maya's military medical career had been her assignment to a classified special operations unit, where she'd served as the primary medical officer for missions that required the highest level of surgical expertise under the most challenging conditions imaginable. The details of those missions remained classified, but her service record included commendations that spoke to her extraordinary performance under pressure. Among her decorations was a Bronze Star with V device for valor, earned when she'd continued performing surgery on wounded soldiers while the field hospital came under direct enemy fire. She'd also received a Purple Heart after being wounded by shrapnel while treating casualties from an IED attack, though she'd continued working until all wounded soldiers had been stabilized before accepting treatment for her own injuries. Maya's military medical kit, hidden in her apartment closet, contained instruments and supplies that reflected her specialized training. Custom-modified surgical tools designed for field use, experimental medications that weren't available in civilian medicine, and equipment that had been specifically developed for the kind of high-stakes emergency surgery that Maya had performed dozens of times during her military service. The technical manuals and medical texts that sat on her apartment shelves were far more advanced than what would be expected for a civilian nurse. They covered surgical techniques that were rarely performed outside of major trauma centers, emergency procedures that were typically reserved for the most experienced physicians, and battlefield medicine protocols that had been developed through years of military medical research. Maya's laptop contained files that told the story of her military medical career in detail. After-action reports from surgical procedures performed under fire, research papers she'd contributed to regarding battlefield trauma care, and correspondence with colleagues who'd served alongside her in some of the most dangerous medical assignments the military had to offer. Most significantly, Maya's medical knowledge extended far beyond what she'd learned in formal training programs. Her combat experience had taught her to improvise, to work with whatever tools and supplies were available, to make life-or-death decisions with incomplete information and under extreme pressure. She'd learned to trust her instincts, to work quickly and efficiently, and to maintain the kind of calm focus that allowed her to save lives when seconds mattered more than protocol. The irony of her current situation at Memorial General wasn't lost on Maya. She was working as a nurse under doctors who had never performed surgery under fire, who had never treated the kind of massive trauma she'd handled routinely during her military service, who had never been required to make the kind of split-second decisions that had defined her career as a combat surgeon. every day. Maya watched procedures that she could perform more efficiently, observed treatment decisions that she would have handled differently, and remained silent about knowledge that could potentially save lives. Her military training had given her capabilities that exceeded those of most civilian emergency physicians, but revealing that training would mean explaining why someone with her qualifications was working as a nurse rather than practicing as a surgeon. The decision to conceal her background hadn't been made lightly. Maya's transition from military to civilian medicine had been complicated by the grief and trauma associated with losing James, but it had also been influenced by her desire to serve in a way that didn't constantly remind her of the violence and danger that had defined her military years. As Maya prepared for another night shift at Memorial General, handling her routine nursing duties while Dr. Walsh continued his pattern of dismissive treatment, she had no idea that her carefully guarded secret was about to be revealed in the most dramatic way possible. The crisis that was approaching would demand every skill she'd learned in combat, every technique she'd mastered under fire, and every lesson her military service had taught her about the difference between competence and excellence under pressure. The systematic undermining of Maya's credibility had evolved into a daily routine that followed predictable patterns, each interaction designed to reinforce Dr. Walsh's perception of her as incompetent and unreliable. What had started as professional skepticism had morphed into something more personal, more deliberate, and increasingly difficult for other staff members to ignore. Maya's shifts typically began at 7 p.m. with a handoff from the day nursing staff, a process that allowed for the transfer of patient information and ongoing care responsibilities. During these transitions, Walsh had developed a habit of inserting himself into conversations about patients Maya would be monitoring, questioning her understanding of basic procedures and suggesting that she might not be capable of handling complex cases. "Bennett will be taking over Mrs. Patterson's care," the day nurse would report during a typical handoff. "She's stable post-surgery, pain management protocol in place, vitals have been consistent." Walsh would immediately interject, addressing Maya directly in front of the entire nursing staff. "Bennett, you understand that post-surgical patients require constant monitoring, right? Any change in vital signs needs to be reported immediately. Don't wait to see if things improve on their own." The implication was clear. Walsh assumed Maya was incompetent to handle basic nursing responsibilities that she'd been managing successfully for months. These public corrections were particularly galling because Maya's patient monitoring was consistently more thorough and accurate than what many of her colleagues provided, a reflection of her military training in battlefield triage and critical care. Maya's response to these interactions remained professionally neutral, but the cumulative effect was beginning to wear on her. "Understood, doctor. I'll monitor her closely and report any changes immediately." Her tone was respectful, but those who knew her well could detect the slight tension that suggested these constant corrections were more insulting than Walsh realized. The pattern extended to medical procedures, where Walsh had begun second-guessing Maya's technical skills in ways that were both unnecessary and professionally inappropriate. During routine tasks like fore insertion, medication administration, or wound care, Walsh would hover nearby, offering corrections and suggestions that implied Maya was likely to make mistakes. "Make sure you're using proper sterile technique," he'd announce while Maya was preparing to change a patient's surgical dressing, despite her having performed the procedure flawlessly dozens of times. Cross-contamination is a serious risk with post-operative wounds. Nurse Jennifer Kim had begun documenting these interactions, recognizing that Walsh's behavior had crossed the line from professional guidance into harassment. She'd worked with Maya on enough procedures to know that her colleagues' technical skills were exceptional, often exceeding what was demonstrated by nurses with years more experience. "He's creating a hostile work environment," Kim confided to David Lee, another nurse who'd witnessed Walsh's treatment of Maya. "She's one of the most competent nurses we have, but he's treating her like she's fresh out of nursing school." Lee nodded in agreement. I've seen her handle emergency situations that would rattle veteran nurses. Remember that motorcycle accident last month? She had the patient stabilized and prepped for surgery faster than anyone else could have managed. Walsh's treatment of her doesn't match her actual performance. The motorcycle accident Lee referenced had been a defining moment for several staff members who'd witnessed Maya's response to a critical trauma case. The patient had arrived with multiple life-threatening injuries, and Maya had coordinated the emergency response with a level of expertise that had impressed everyone in the room except Walsh. During that incident, Maya had anticipated the trauma team's needs, prepared equipment before it was requested, and monitored the patient's condition with the kind of precision that reflected extensive experience with critical care. Her performance had been flawless, yet Walsh had found reasons to criticize her afterward, suggesting that she'd been too assertive in coordinating care and should have waited for physician direction. Nurses need to understand their role in emergency situations, Walsh had announced after the successful treatment. Initiative is good, but not when it means overstepping professional boundaries. The criticism had been particularly unfair because Maya's overstepping had likely contributed to saving the patient's life, but she'd accepted it without argument, maintaining the professional demeanor that had become her trademark response to Walsh's harassment. Dr. Alex Foster had witnessed the motorcycle accident and Walsh's subsequent criticism, and he'd begun to question his colleagues' judgment regarding Maya's capabilities. Foster had worked with enough medical personnel to recognize exceptional competence when he saw it, and Maya's performance during critical cases consistently exceeded what he'd expect from someone with her stated background. Connor, Foster had said privately to Walsh after the motorcycle incident, that nurse handled the trauma response perfectly. I'm not sure what you're seeing that concerns you. Walsh's response had been revealing in its defensiveness. She's hiding something. Alex, no nurse performs like that without extensive trauma experience that she's not acknowledging. I don't trust people who aren't transparent about their qualifications. Foster had found Walsh's reasoning troubling and illogical. So you're criticizing her for being too competent? That doesn't make sense from a patient care perspective. The conversation had ended without resolution, but Foster had begun paying closer attention to the dynamic between Walsh and Maya, recognizing that his colleague's behavior was driven more by personal suspicion than professional concern. Meanwhile, Maya continued to endure the daily humiliations with the same stoic professionalism that had served her during her military career. She'd learned to compartmentalize hostile treatment, to focus on mission objectives rather than personal feelings, and to maintain performance standards, regardless of external circumstances. But the constant criticism was beginning to affect other aspects of her work environment. Some of the newer nursing staff had begun to question Maya's competence based on Walsh's public corrections, despite evidence that contradicted his assessments. The dynamic was creating divisions among the nursing team and undermining the collaborative environment that head nurse Linda Carson had worked to maintain. Carson had begun documenting Walsh's behavior more systematically, recognizing that the situation was affecting department morale and potentially patient care. She'd observed several incidents where Walsh's treatment of Maya had created tension during critical procedures, distracting staff attention from patient needs. This can't continue, Carson confided to her supervisor during a monthly administrative meeting. Dr. Walsh's behavior toward one of our nurses is creating problems for the entire department. Either he needs to adjust his approach, or we need to consider other options. The administrative machinery of hospital personnel management was beginning to take notice of the situation, though slowly and with the kind of bureaucratic caution that characterized large medical institutions. Documentation was being gathered, witness statements were being collected, and policies regarding workplace harassment were being reviewed. But Maya remained focused on her patients and her work, maintaining the high standards that had defined her throughout her medical career. She'd endured worse treatment during her military service, and she was determined not to let Walsh's behavior compromised her commitment to providing excellent patient care. What Maya didn't realize was that her restraint and professionalism in the face of Walsh's harassment had actually enhanced her reputation among most of the medical staff. Nurses respected her ability to maintain composure under pressure. Doctors appreciated her competence and reliability, and patients consistently praised her attentiveness and skill. The stage was being set for a confrontation that would reveal the true extent of Maya's capabilities, but it would come not through her choosing to defend herself against Walsh's treatment, but through a medical emergency that would demand every skill she'd learned in combat and every lesson her military service had taught her about excellence under pressure. The breaking point began to emerge during the second week of November, when Dr. Walsh's treatment of Maya shifted from professional dismissal to something that approached open hostility. The catalyst was a patient care incident that highlighted the growing disconnect between Walsh's perception of Maya's abilities and the reality of her competence, creating a confrontation that would force other staff members to choose sides. The incident involved Mrs. Eleanor Rodriguez, a 73-year-old woman who'd been admitted to the emergency department with symptoms that initially appeared to be routine gastric distress. Maya had been assigned to monitor Mrs. Rodriguez during the night shift, conducting regular vital sign checks and ensuring her comfort while the medical team determined the appropriate treatment plan. What Maya had observed during her monitoring suggested that Mrs. Rodriguez's condition was more serious than the initial assessment indicated. The patient's pain patterns, subtle changes in her vital signs, and certain physical presentations were consistent with something Maya had seen multiple times during her military service: the early stages of internal bleeding that could rapidly become life-threatening if not addressed promptly. Maya's military experience had taught her to recognize signs that civilian medical training often missed or dismissed as minor variations in normal presentations. Her combat medical background had exposed her to internal injuries that progressed quickly from manageable to critical, and she'd learned to identify warning signs that appeared hours before obvious symptoms developed. Following proper protocol, Maya had documented her observations and reported her concerns to Dr. Walsh, who was the attending physician responsible for Mrs. Rodriguez's care. She'd presented her findings professionally and objectively, noting the specific changes in vital signs and pain patterns that had caught her attention. Walsh's response had been dismissive and condescending, delivered in a tone that made it clear he considered Maya's concerns to be the product of inexperience and anxiety rather than legitimate medical observation. "Bennett, Mrs. Rodriguez has been examined by qualified physicians," Walsh had said, his voice carrying enough volume to be heard by nearby staff members. "Her symptoms are consistent with gastric upset, possibly related to medication side effects. We don't need nurses creating panic by imagining complications that don't exist." Maya had persisted, recognizing that her concerns were based on pattern recognition that came from extensive trauma experience, even though she couldn't explain that background without revealing her military service. "Doctor, I understand the initial assessment, but I'm observing changes that might indicate internal bleeding. Her pulse rate has increased gradually over the past 2 hours. Her blood pressure has dropped slightly but consistently, and her pain pattern has shifted in ways that suggest." Walsh had cut her off mid-sentence, his interruptions sharp enough to draw attention from across the emergency department. "Bennett, you're a nurse, not a diagnostician. Your job is to monitor vital signs and report them, not to interpret medical data or question physician assessments. Mrs. Rodriguez is stable, and your concerns are noted but unnecessary. The public nature of Walsh's dismissal had been humiliating enough, but what followed was worse. Walsh had used the incident as an opportunity to question Maya's competence in front of other staff members, suggesting that her overreaction to routine patient monitoring indicated she might not be suited for emergency department work. "This is exactly the kind of thinking that creates problems in emergency medicine," Walsh had announced to the nursing staff. Inexperienced personnel who mistake normal variations for crisis situations. It's important to know your limitations and trust qualified professionals to make medical decisions. Maya had accepted the criticism without argument, but her concern for Mrs. Rodriguez had continued to grow as she observed additional changes that reinforced her initial assessment. The patient's condition was deteriorating in ways that were subtle but consistent with internal bleeding, and Maya's military training was screaming warnings that she couldn't ignore. Jennifer Kim had witnessed the entire exchange and was appalled by Walsh's treatment of Maya, particularly because she'd worked with Maya long enough to trust her judgment about patient care. "Maya," Kim had said privately, "I've seen you handle dozens of cases, and you don't panic or overreact. If you're concerned about Mrs. Rodriguez, there's probably a good reason." Maya had appreciated Kim's support, but she'd also recognized that pursuing her concerns further would mean directly challenging Walsh's medical authority, something that could have serious consequences for her position at Memorial General. "I've reported my observations," Maya had said quietly. "That's all I can do within the proper channels." But Maya's training and experience wouldn't let her ignore what she was seeing. Over the next 4 hours, she'd continued monitoring Mrs. Rodriguez closely, documenting every change in her condition and building a case that became increasingly difficult to dismiss. The patient's vital signs showed a pattern that Maya recognized from battlefield medicine: the gradual deterioration that preceded hemorrhagic shock. At 3 a.m., Maya had made the decision to approach Dr. Foster, who was also on duty that night and had demonstrated more respect for nursing input than Walsh typically showed. She'd presented her documentation systematically, showing the trends and vital signs that indicated Mrs. Rodriguez's condition was worsening despite the stable appearance. Foster had reviewed Maya's notes with the attention they deserved, recognizing the thoroughness and precision of her documentation. Unlike Walsh, Foster had enough experience to know that competent nurses often observed changes that were medically significant, even when those changes weren't immediately obvious to physicians. "This is excellent documentation," Foster had told Maya after reviewing her charts. "You're right to be concerned about these trends. Let me examine Mrs. Rodriguez and see what we're dealing with." Foster's examination had confirmed Maya's suspicions. Mrs. Rodriguez was indeed experiencing internal bleeding, probably from a small perforation that had been gradually worsening since her admission. The condition required immediate surgical intervention, and the early detection Maya had provided would likely save the patient's life. "You were absolutely right," Foster had told Maya as they prepared Mrs. Rodriguez for emergency surgery. "If we'd waited until morning to address this, she could have gone into shock. Your monitoring and documentation probably saved her life." The successful identification and treatment of Mrs. Rodriguez's condition should have been a moment of professional validation for Maya, but Walsh's response had been defensive and hostile rather than appreciative. Anyone could have noticed those changes eventually, Walsh had said when informed about the emergency surgery. "Bennett got lucky with her guess, but that doesn't validate her tendency to create drama around routine cases." Walsh's refusal to acknowledge that Maya had been correct, combined with his attempt to minimize her contribution to saving Mrs. Rodriguez's life, had finally pushed several staff members beyond their tolerance for his behavior. Dr. Foster had been particularly direct in his response to Walsh's dismissal of Maya's competence. "Connor, that nurse potentially saved a patient's life through careful observation and proper documentation. Instead of criticizing her judgment, maybe you should be asking yourself why you missed the signs she caught." The confrontation between the two physicians had been overheard by multiple staff members, creating a division within the emergency department that reflected broader concerns about Walsh's treatment of nursing staff and his approach to patient care. Head nurse Linda Carson had also reached her limit with Walsh's behavior, particularly after witnessing how he'd handled the Mrs. Rodriguez situation. "Dr. Walsh," Carson had said in a formal meeting the following day, I need to address your interactions with my nursing staff. Your treatment of Maya Bennett is creating problems for this department, and yesterday's incident with Mrs. Rodriguez demonstrates that your personal issues with her are potentially affecting patient care. Walsh's defensive response had revealed the depth of his hostility toward Maya and his unwillingness to acknowledge the problems his behavior was creating. Linda, I maintain appropriate professional standards with all staff members. If Bennett feels criticized, perhaps she should consider whether her performance meets the expectations of this department. The meeting had ended without resolution, but Carson had made it clear that she would be documenting all future interactions between Walsh and Maya, and that she was prepared to escalate the matter to hospital administration if the behavior continued. Meanwhile, Maya continued her work with the same professional competence that had always characterized her approach to patient care. But the stress of the ongoing conflict was beginning to take its toll. She was becoming increasingly isolated within the department, caught between Walsh's hostility and the growing sympathy of colleagues who recognized the unfairness of her treatment. The situation was approaching a crisis point that would demand resolution, and Maya was beginning to realize that her strategy of maintaining anonymity and avoiding confrontation might not be sustainable in an environment where her competence was being systematically undermined by someone who was supposed to be her colleague. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. The call came in at 11:47 p.m. on a frigid December night, when Chicago's emergency services were already stretched thin by weather-related accidents and the usual weekend surge of trauma cases. Memorial General's emergency department was operating at near capacity, with every trauma bay occupied and the waiting room filled with patients experiencing varying degrees of medical urgency. Maya was in the middle of administering medication to a patient with chest pain when the emergency radio crackled to life with the kind of alert that made every medical professional in the room stop what they were doing and listen. Memorial General, this is Paramedic Unit 47. We have a code red trauma inbound, ETA 8 minutes. Multiple vehicle collision on the Dan Ryan Expressway involving a city bus and 3 passenger vehicles. We're transporting a 26-year-old male, massive chest trauma, possible internal bleeding, unstable vitals. Patient was trapped for approximately 40 minutes before extraction. The dispatcher's voice continued with clinical precision, but Maya could hear the underlying tension that indicated the severity of the situation. Patient presents with severe crush injuries to the chest and abdomen, possible pneumothorax, significant blood loss, and periods of unconsciousness. Blood pressure dropping, pulse thready and rapid. This is going to be a challenging save. Dr. Walsh, who was serving as the senior attending physician for the night shift, immediately began coordinating the trauma response. Memorial General's protocol for Code Red cases required a full trauma team, including multiple physicians, specialized nursing staff, and immediate access to surgical facilities if the patient's condition warranted emergency intervention. I want Trauma Bay 1 prepped immediately, Walsh announced to the emergency department staff. Full surgical setup, blood products standing by, and I need our most experienced trauma nurse assisting. This sounds like it's going to require everything we've got. Maya had been working trauma cases at Memorial General long enough to know that she was one of the most qualified nurses available for this type of emergency, but she also knew that Walsh would never voluntarily request her assistance for a case of this magnitude. His pattern of dismissing her competence made it unlikely that he would trust her with a patient whose life hung in the balance, as expected. Walsh turned to Jennifer Kim, who was an excellent nurse, but had significantly less trauma experience than Maya. Kim had worked at Memorial General for 5 years and was competent in emergency procedures, but she'd never encountered the kind of massive trauma that was apparently heading their way. Kim, I need you on this case, Walsh said, his tone carrying the urgency that reflected the seriousness of the incoming patient. "This is going to be complex, and I need someone I can count on to anticipate my needs and respond quickly to changing conditions." Maya continued her work with the chest pain patient, but part of her attention remained focused on the trauma preparation taking place across the emergency department. Her military experience had taught her to automatically assess available resources during crisis situations, and she could see that the trauma team was about to face challenges that would test the limits of their collective experience. The patient. Arriving in Trauma Bay, one was presenting with injuries that Maya had encountered multiple times during her military service. Massive chest trauma with possible internal bleeding. The kind of complex case that required not just technical competence, but the ability to make rapid decisions under extreme pressure, while coordinating multiple treatment priorities simultaneously. Maya's military training was already running through potential scenarios based on the paramedics' initial assessment. Crush injuries to the chest and abdomen suggested possible damage to major organs, blood vessels, and skeletal structures. The mention of possible pneumothorax indicated that the patient might require immediate chest tube placement to prevent respiratory failure. The periods of unconsciousness and dropping blood pressure suggested significant blood loss that would require rapid intervention to prevent hemorrhagic shock. These were exactly the types of injuries Maya had treated repeatedly during her combat deployments, often under conditions that were far more challenging than anything a civilian hospital would face. She'd performed emergency surgery on similar cases while under enemy fire, with improvised equipment and in locations where normal medical protocols were impossible to maintain. But Maya also knew that revealing her extensive trauma experience would mean explaining her military background, something she'd been carefully avoiding since joining Memorial General's staff. The decision to maintain her cover as a civilian nurse with limited trauma training had served her well in avoiding unwanted attention, but it also meant watching potentially life-threatening situations unfold without being able to contribute the full extent of her capabilities. The ambulance arrival was announced by the sound of sirens and the controlled chaos that always accompanied critical trauma cases. Maya could hear the paramedics communicating with the emergency department staff as they prepared to transfer their patient, and their radio reports confirmed that the situation was as serious as initially indicated. Patient is Tyler Morrison, 26 years old, construction worker. The lead paramedic reported as the ambulance doors opened. Massive chest trauma from steering wheel impact, possible cardiac contusion, definitely has internal bleeding. Based on the blood pressure trends we've been seeing during transport, Maya caught a glimpse of the patient as he was wheeled past her station toward Trauma Bay 1, and her military experience immediately recognized the severity of his condition. Morrison was pale, his breathing was labored, and his overall presentation suggested someone who was rapidly approaching the point where conventional emergency medicine might not be sufficient to save his life. The trauma team that gathered around Morrison included Dr. Walsh, Jennifer Kim, Dr. Foster, who'd been called in to assist, and 2 other nurses who specialized in emergency procedures. It was a competent team by civilian standards, but Maya could see from across the emergency department that they were about to encounter challenges that would push their collective experience to its limits. Walsh began his initial assessment with the systematic approach that characterized emergency medicine, checking vital signs, evaluating the extent of Morrison's injuries, and determining the immediate treatment priorities. But Maya could see from his body language and the increasingly urgent tone of his communications with the team that he was recognizing the complexity of what they were facing. "This is worse than the paramedic reports indicated," Walsh announced to the trauma team. "We've got multiple rib fractures, possible cardiac involvement, and significant internal bleeding that's going to require immediate surgical intervention. Get me a trauma surgeon down here immediately." The problem was that Memorial General's trauma surgeons were already occupied with other critical cases from the same multi-vehicle accident. The emergency department was dealing with multiple patients. From the bus collision, and the hospital's surgical resources were stretched beyond their normal capacity. "Dr. Walsh," came the response from the surgical coordinator, "our trauma surgeons are currently in surgery with other patients from this same accident. The earliest we can get someone down to the emergency department is probably 45 minutes to an hour." Maya could see the recognition dawning on Walsh's face that Tyler Morrison might not survive long enough for a trauma surgeon to become available. The patient's condition was deteriorating rapidly. His blood pressure was continuing to drop despite fluid resuscitation, and his breathing was becoming increasingly labored in ways that suggested his injuries were progressing beyond what emergency medicine protocols could address. The trauma team was about to face a situation that would require capabilities beyond their normal scope of practice. And Maya was watching it unfold with the knowledge that she possessed exactly the skills they needed but couldn't reveal without fundamentally changing her carefully constructed identity at Memorial General. The crisis was approaching the point where someone would need to make decisions that went beyond normal emergency medicine protocols, and Maya was beginning to realize that her commitment to maintaining anonymity might be in direct conflict with her obligation to save a patient's life. Tyler Morrison's blood pressure dropped to 70/40ths at 12:03 a.m., and Maya watched from across the emergency department as the trauma team struggled with a situation that was rapidly spiraling beyond their control. The young construction worker's breathing had become increasingly labored. His skin was taking on the grayish pallor that indicated severe blood loss, and his responses to verbal commands were becoming inconsistent in ways that suggested his brain wasn't receiving adequate oxygen. Dr. Walsh was working systematically through emergency protocols, but Maya could see the growing frustration and uncertainty in his movements. He'd ordered additional 4 fluids, administered pain medication, and requested blood products, but Morrison's condition continued to deteriorate despite these interventions. The trauma team was facing the reality that their patient needed surgical intervention that wouldn't be available for at least another 30 minutes. "His pressure's still dropping," Jennifer Kim reported, her voice carrying the tension that reflected the team's growing concern. 80/50 now, and his pulse is up to 140. The fluid resuscitation isn't holding. Maya had been monitoring the situation while continuing her assigned duties with other patients, but her military training was automatically calculating the time factors involved in Morrison's case. Based on his presentation and the rate of his deterioration, she estimated he had perhaps 15 minutes before his condition became irreversible. Regardless of what surgical intervention might become available later, the decision point came when Morrison suddenly went into respiratory distress, his breathing becoming rapid and shallow in a way that indicated his injuries were affecting his ability to maintain adequate oxygen levels. Maya could see from across the room that he was developing what appeared to be a tension pneumothorax, a condition where air trapped in the chest cavity was compressing his lungs and compromising his cardiovascular function. "Dr. Walsh," Kim called out, her voice rising with alarm. "His oxygen saturation is dropping rapidly. He's down to 85% and falling." Walsh immediately moved to assess Morrison's breathing, but Maya could see that he was uncertain about how to proceed. Tension pneumothorax was a life-threatening condition that required immediate intervention, but the procedure to address it, needle decompression or chest tube placement, was typically performed by trauma surgeons rather than emergency physicians. Maya made her decision in that moment, recognizing that Morrison would die if someone didn't act immediately, with skills that went beyond what the current trauma team possessed. She approached Trauma Bay 1 with the kind of purposeful movement that had characterized her response to medical emergencies during her military service. "Dr. Walsh," Maya said, her voice carrying a tone of authority that made the entire trauma team turn to look at her. "Tyler needs immediate chest decompression. His presentation is consistent with tension pneumothorax, and his condition is going to become irreversible if we don't act in the next few minutes. Walsh's response was predictably dismissive, but Maya could see the uncertainty in his eyes that indicated he recognized the severity of the situation, even if he wasn't willing to acknowledge her assessment. "Bennett, we're handling this case. Your observations are noted, but we don't need nursing input on surgical decisions." Maya ignored Walsh's dismissal and moved closer to Morrison, her trained eyes taking in details that confirmed her initial assessment. The patient's neck veins were distended, his trachea was shifting slightly to one side, and his chest movement was asymmetrical in ways that were classic presentations of tension pneumothorax. "Doctor, with respect, this patient is going to arrest if someone doesn't perform immediate needle decompression," Maya said, her voice remaining calm, but carrying an undertone of urgency that reflected her understanding of how quickly the situation could become fatal. "I can see the classic triad of symptoms, and his vitals are consistent with cardiovascular compromise from thoracic pressure." Dr. Foster, who'd been assisting with the case, looked at Maya with surprise at the precision and confidence of her assessment. Foster had enough experience to recognize that Maya's clinical observations were accurate and that her recommendation was probably correct, but he was also aware that needle decompression was not typically within a nurse's scope of practice. "Maya," Foster said carefully, "your assessment sounds right, but this procedure requires—" Maya cut him off gently but firmly, recognizing that every second of delay was potentially fatal for Morrison. "Dr. Foster, I understand the protocol concerns, but this patient needs intervention now. I've performed this procedure multiple times under field conditions, and I can walk Dr. Walsh through it if he's not familiar with the technique." The statement hung in the air for a moment as the trauma team processed the implications of what Maya had just said. Her reference to field conditions and her confidence in describing a complex medical procedure suggested experience that went far beyond what anyone had expected from a civilian nurse. Walsh's response was defensive and hostile, but Maya could see that he was also recognizing that Morrison's condition was beyond his comfort level. "Bennett, I don't know what kind of training you think you have, but emergency procedures are performed by qualified physicians, not nurses who've watched too many medical shows." Maya looked at Morrison, whose condition was continuing to deteriorate, and made a decision that would fundamentally change her relationship with everyone in the emergency department. "Dr. Walsh, Tyler Morrison is going to die in the next 5 minutes if someone doesn't decompress his chest," Maya said, her voice carrying the kind of calm authority that came from having made life or death decisions under pressure. "I'm qualified to perform this procedure. I've done it successfully multiple times, and I'm prepared to take responsibility for the outcome." Before Walsh could respond, Maya had moved to Morrison's bedside and was conducting the kind of rapid assessment that reflected extensive trauma experience. Her hands moved with practiced efficiency, palpating his chest, checking his pulse, and evaluating his breathing in ways that demonstrated familiarity with critical care that exceeded what anyone had expected. "I need a 14-gauge needle, sterile prep solution, and lidocaine for local anesthesia," Maya announced to the trauma team, her tone making it clear that she was no longer asking for permission, but was taking control of a medical emergency that demanded immediate action. Jennifer Kim looked at Walsh uncertainly, but Maya's confidence and the obvious deterioration in Morrison's condition made the decision clear. "Get her what she needs," Foster said quietly, recognizing that Maya's intervention might be Morrison's only chance for survival. Maya worked quickly but methodically, prepping Morrison's chest with the kind of sterile technique that reflected extensive surgical training. Her movements were precise and confident, showing none of the hesitation that might be expected from someone performing an unfamiliar procedure. "Tyler, I'm going to help you breathe better," Maya said to Morrison, who was still conscious but clearly struggling. "You're going to feel some pressure, but this will relieve the problem with your chest." The needle decompression was performed with the kind of smooth efficiency that reflected extensive experience with emergency procedures. Maya inserted the needle at precisely the right location, and the immediate release of trapped air confirmed her diagnosis and the success of the intervention. Morrison's breathing improved almost immediately. His oxygen saturation began to rise, and his blood pressure stabilized at levels that indicated the immediate crisis had been resolved. The trauma team stood in stunned silence as they watched Maya complete the procedure with a level of competence that challenged everything they thought they knew about her qualifications and background. "Where the hell did you learn to do that?" Walsh demanded, his voice mixing amazement with suspicion. Maya looked at Morrison, who was breathing more easily and showing signs of stabilization, then at the trauma team that was staring at her with expressions ranging from admiration to confusion. "I learned it in Afghanistan," Maya said simply, recognizing that her carefully maintained cover had been irreversibly shattered, along with a lot of other procedures that might be useful if Tyler needs additional intervention before the trauma surgeons become available. The words hung in the air like a confession that changed everything about how the trauma team viewed Maya Bennett. Afghanistan. The single word carried implications that recontextualized every interaction they'd had with her over the past 8 months. Every moment when she demonstrated competence that seemed to exceed her stated qualifications. Every instance when her calm under pressure had struck them as unusual for a civilian nurse. Dr. Walsh's response was immediate and defensive. But before he could voice his skepticism, Tyler Morrison's condition took another dramatic turn for the worse. "His pressure's dropping again," Jennifer Kim announced, her voice tight with concern. "Down to 65/40, and his pulse is climbing." The needle decompression helped his breathing, but something else is happening. Maya had been monitoring Morrison continuously since completing the chest procedure, and her military training was already identifying the next phase of his medical crisis. The young construction worker was showing signs of internal bleeding that was more severe than the trauma team had initially realized, and his condition was approaching the point where he would need immediate surgical intervention to survive. "He's bleeding internally," Maya said, her voice carrying the kind of clinical certainty that came from extensive trauma experience. "Probably from the spleen or liver, based on his mechanism of injury and presentation. His blood pressure is dropping because he's losing volume faster than we can replace it with fluids." Dr. Foster looked at Maya with recognition that her assessment was probably correct, but also with awareness that internal bleeding required surgical repair that was beyond the scope of emergency medicine. "You're right, but there's nothing we can do about internal bleeding without a surgeon," Foster said. "We can support him with fluids and blood products, but if he's actively bleeding from major organs, he needs an operating room." Maya looked at Morrison, whose skin was becoming increasingly pale and whose responses were becoming sluggish in ways that indicated his brain wasn't receiving adequate blood flow. She calculated quickly. The trauma surgeons were still at least 20 minutes away, and Morrison's condition suggested he didn't have that long before going into irreversible shock. "Dr. Foster," Maya said, her voice carrying a tone of authority that made everyone in the trauma bay pay attention, "Tyler doesn't have 20 minutes. If he's bleeding from his spleen, and his pressure continues to drop at this rate, he's going to arrest before any surgeon gets here." Walsh finally found his voice, but it carried the defensive hostility that had characterized his treatment of Maya since she'd first demonstrated competence that exceeded his expectations. "Bennett, I don't care what you think you learned in Afghanistan. Internal bleeding requires surgical repair in an operating room, not emergency procedures in a trauma bay. This patient needs proper medical care, not field medicine." Maya looked at Walsh with the kind of steady gaze that had served her during her military career when dealing with hostile superiors who didn't understand the realities of combat medicine. "Dr. Walsh, Tyler Morrison is going to die if someone doesn't control his bleeding in the next 15 minutes, Maya said, her voice remaining calm but carrying an undertone of steel that reflected her certainty about the medical facts. "I've performed emergency splenectomy under field conditions multiple times. I can save his life, but only if you're willing to let me work. The statement sent shockwaves through the trauma team. Emergency splenectomy was major surgery, typically performed by experienced trauma surgeons in fully equipped operating rooms. The idea that a nurse was claiming the ability to perform such a procedure seemed impossible to everyone except Maya, who'd done exactly that during her military service. "That's impossible," Walsh said flatly. "Nurses don't perform surgery, regardless of their military experience. This patient needs someone who can stop his bleeding before he bleeds to death." Maya interrupted, her military training overriding the civilian deference she'd maintained for months. "I'm a board-certified trauma surgeon with 6 years of combat medical experience. I've performed this exact procedure under conditions that make this trauma bay look like a luxury operating room." The revelation hit the trauma team like a physical blow. Board-certified trauma surgeon. 6 years of combat medical experience. Everything about Maya's behavior over the past months suddenly made sense. Her competence, her calm under pressure, her ability to anticipate medical needs, her assessment skills that exceeded what anyone had expected from a civilian nurse. Dr. Foster was the first to recover from the shock, recognizing that if Maya's claims were true, Morrison might actually have a chance for survival. "Maya, are you saying you're actually qualified to perform major surgery?" Foster asked, his voice mixing amazement with hope. Maya looked at Morrison, whose condition was continuing to deteriorate, and made the decision to reveal the full extent of her background. "I'm Dr. Maya Bennett, former captain, U.S. Army Medical Corps. I served as a combat surgeon with Special Operations Forces for 6 years, including 2 deployments to Afghanistan and 1 to Iraq. I've performed emergency surgery under fire, in bombed-out buildings, and in the back of moving vehicles. I can save Tyler's life, but I need your help and I need it now." The transformation in Maya's demeanor was immediate and dramatic. The quiet, deferential nurse disappeared, replaced by a confident surgeon who moved with the kind of authority that came from commanding respect in life-or-death situations. "Jennifer, I need you to contact the blood bank and get me 4 units of O-negative. Immediately," Maya commanded, her voice carrying the tone of someone accustomed to giving orders in medical emergencies. "Dr. Foster, I need you to intubate Tyler and maintain his airway. Dr. Walsh, I need you to establish additional 4 access and start massive transfusion protocol." Maya began preparing for surgery with movements that reflected extensive operative experience. She scrubbed quickly but thoroughly, her hands moving with the kind of practiced efficiency that spoke to thousands of hours in operating rooms and field surgical settings. "This is insane," Walsh protested, but his voice lacked conviction as he watched Maya's professional preparation. "Hospital administration will never approve emergency surgery performed by someone who's not credentialed here." Maya looked at Walsh with the kind of steady gaze that had served her during combat operations when making decisions that couldn't be delegated or delayed. "Dr. Walsh, Tyler Morrison will be dead in 10 minutes if someone doesn't control his bleeding. Hospital administration can investigate my credentials after we save his life. Right now, I'm the only person in this room qualified to perform the surgery he needs." Maya made her first incision with the kind of smooth precision that reflected extensive surgical training. Her movements were confident and economical, demonstrating familiarity with anatomy and surgical technique that was immediately obvious to anyone watching. "Jesus," Dr. Foster whispered as he watched Maya work. "She actually knows what she's doing." Maya opened Morrison's abdomen with the systematic approach that characterized expert surgical technique, identifying and isolating the source of his bleeding with efficiency that would have impressed trauma surgeons in the best-equipped civilian hospitals. "Splenic laceration, grade 4, Maya announced as she identified the injury. "Extensive bleeding, but repairable if we work quickly." What followed was a display of surgical skill that left the trauma team speechless. Maya controlled Morrison's bleeding, repaired his damaged spleen, and managed his cardiovascular status with the kind of expertise that reflected years of performing similar procedures under the most challenging conditions imaginable. Throughout the surgery, Maya maintained constant communication with the trauma team, teaching them techniques and approaches that reflected her extensive combat experience while demonstrating surgical competence that exceeded anything they'd expected to witness in their emergency department. "Tyler's pressure is stabilizing," Jennifer Kim reported, her voice mixing amazement with relief. "His bleeding is controlled and his vitals are improving." Maya completed the surgery with the same methodical precision that had characterized her approach to everything else, closing Morrison's incision with suture technique that reflected extensive operative training. "Tyler's going to make a full recovery," Maya announced as she finished the procedure. "The surgery was successful, his bleeding is controlled, and his vital signs are stable." The trauma team stood in stunned silence as they processed what they'd just witnessed. Maya Bennett, the quiet nurse they'd worked alongside for 8 months, had just performed major surgery that saved a patient's life under conditions that would have challenged the most experienced trauma surgeons. Dr. Walsh's face reflected a complex mixture of emotions: amazement, embarrassment, and the dawning recognition that his treatment of Maya over the past months had been not just unprofessional, but directed at someone whose qualifications far exceeded his own. The silence that followed Maya's completion of the emergency surgery was profound and uncomfortable, broken only by the steady rhythm of Tyler Morrison's heart monitor and the soft hiss of his ventilator. The trauma team stood around the surgical site, staring at Maya as she methodically removed her gloves and cleaned her hands with the same careful precision that had characterized every aspect of the procedure they just witnessed. Jennifer Kim was the first to find her voice, though it came out as barely more than a whisper. "Maya, you just performed major surgery in our trauma bay, and Tyler's going to live because of it." Maya looked at Morrison, whose color was already improving as his blood pressure stabilized and his vital signs returned to normal ranges. The young construction worker who'd been minutes away from death was now breathing steadily, his wounds properly repaired, his condition stable enough for transport to the intensive care unit. "Emergency splenectomy under field conditions," Maya said simply, as if she'd just completed a routine nursing procedure rather than major surgery that had saved a patient's life. "It's not much different from what we did in Afghanistan, except we had better lighting and sterile conditions." Dr. Foster, who'd assisted during the procedure, was shaking his head in amazement as he processed what he'd witnessed. "Maya, that was extraordinary surgical technique. The way you identified the bleeding, controlled it, and repaired the damage. I've worked with trauma surgeons who couldn't have done what you just did, especially under these circumstances." Maya appreciated Foster's recognition, but she was also aware that her revelation had fundamentally changed her relationship with everyone in the emergency department. The quiet nurse who'd endured months of dismissive treatment was gone, replaced by someone whose qualifications and experience demanded a completely different level of professional respect. "I've had a lot of practice with similar cases," Maya said, beginning to clean up the surgical instruments she'd used. "Combat surgery teaches you to work efficiently with whatever resources are available." Dr. Walsh had remained silent during the immediate aftermath of the surgery, but Maya could see that he was struggling to process the implications of what had just occurred. For months, he dismissed her competence, questioned her judgment, and treated her as an inexperienced nurse who needed constant supervision. The reality that she was a board-certified surgeon with extensive trauma experience was forcing him to confront the possibility that his behavior had been not just unprofessional, but directed at someone whose medical expertise exceeded his own. "I don't understand," Walsh finally said, his voice carrying a mixture of confusion and defensive hostility. "If you're actually a surgeon, why are you working as a nurse?" Why didn't you tell anyone about your qualifications? Why let everyone treat you like... Maya looked at Walsh with the kind of steady gaze that had served her during difficult conversations with military superiors. Like an incompetent nurse who didn't know her place. Maya finished his sentence with a tone that carried just enough edge to make Walsh aware that she remembered every dismissive comment, every public correction, every instance when he'd questioned her competence in front of other staff members. Trauma Bay fell silent again as the full weight of Walsh's months of harassment became apparent to everyone present. Maya hadn't just been enduring unprofessional treatment from a colleague, she'd been subjected to systematic dismissal by someone whose qualifications were significantly inferior to her own. Jennifer Kim was the first to grasp the full implications of the situation. Maya, you've been letting Dr. Walsh treat you like you were incompetent when you're actually more qualified than he is, Kim said, her voice mixing amazement with anger. Why didn't you defend yourself? Why didn't you tell us who you really were? Maya finished organizing the surgical instruments and turned to face the trauma team with the kind of composure that reflected her military training in handling difficult post-operation discussions. Because I wasn't ready to be Dr. Bennett again, Maya said quietly. After my military service ended, I needed to find a way to practice medicine that didn't constantly remind me of combat, of trauma, of the reasons why people need emergency surgery. Being a nurse allowed me to help patients without having to carry the full weight of surgical responsibility. Dr. Foster was beginning to understand the complexity of Maya's situation and the personal cost of the decision she'd made to conceal her background. But Maya, you're wasting your skills working as a nurse. With your qualifications and experience, you could be heading a trauma surgery department, training other surgeons, making a much bigger impact on patient care. Maya looked at Tyler Morrison, who was stable and ready for transport to the ICU. Then at the trauma team that was still processing the evening's revelations. Tonight proved that my skills aren't wasted, Maya said. Tyler Morrison is alive because I was here, because I was trained to recognize and treat his injuries, and because I was willing to step forward when he needed surgery that no one else could provide. The practical implications of Maya's revelation were beginning to dawn on the hospital staff. Head nurse Linda Carson had been monitoring the emergency surgery from a distance, and she was already considering the administrative complications that would arise from a nurse performing major surgery without proper hospital credentialing. Maya, Carson said as she approached the trauma bay, we need to discuss what just happened here. You saved Tyler's life, and I'm grateful for that. But you also performed surgery without being credentialed at this hospital. There are going to be questions from administration, legal concerns, protocol issues that we'll need to address. Maya nodded, recognizing that her decision to reveal her surgical capabilities would create complications that extended far beyond the immediate medical situation. I understand the administrative challenges. Linda, I'm prepared to face whatever consequences come from my decision to operate on Tyler. But I'm not prepared to apologize for saving a patient's life when I had the skills to do so. Walsh had been listening to the conversation with growing agitation, apparently recognizing that Maya's heroic surgery had made his months of harassment look even more inappropriate than it had seemed before. This whole situation is problematic, Walsh said, his voice carrying defensive anger. Maya concealed her qualifications, performed unauthorized surgery, and violated hospital protocols. The fact that the surgery was successful doesn't change the fact that she acted outside her scope of practice. Maya looked at Walsh with the kind of calm authority that had served her during her military career when dealing with hostile superiors who were more concerned with protocol than patient care. Dr. Walsh, Tyler Morrison was dying, Maya said, her voice remaining professionally calm, but carrying an undertone of steel. No trauma surgeon was available. Conventional emergency medicine wasn't sufficient to save his life, and I had the training and experience necessary to perform the surgery he needed. I chose to save a patient's life rather than let him die while we waited for proper administrative approval. The moral clarity of Maya's position was obvious to everyone in the trauma bay except Walsh, who seemed to be struggling with the reality that his months of dismissive treatment had been directed at someone whose medical judgment and surgical skills far exceeded his own. Dr. Foster stepped forward, recognizing that the situation required leadership from someone who could see beyond the immediate administrative complications to the broader implications of what had occurred. "Maya, what you did tonight was extraordinary," Foster said. "You saved a life using skills that most of us don't possess, under conditions that would have challenged surgeons in the best-equipped operating rooms. Whatever administrative issues we need to resolve, the fact remains that Tyler Morrison is alive because of your competence and courage." Maya appreciated Foster's support, but she was also aware that her decision to reveal her surgical capabilities had permanently changed her position at Memorial General. The quiet anonymity she'd maintained for 8 months was gone, replaced by recognition that would bring both opportunities and challenges. She wasn't sure she was ready to face Dot as Tyler Morrison was wheeled toward the intensive care unit, stable and expected to make a full recovery. Maya reflected on the evening's events and the choices that had led her to this moment. She'd spent months hiding from her identity as a combat surgeon, but tonight had proven that some responsibilities couldn't be avoided. When lives hung in the balance, the reckoning with Dr. Walsh, hospital administration, and her own future at Memorial General was just beginning. But Maya felt a sense of peace about her decision that she hadn't experienced since leaving the military. She'd remembered who she was and what she was capable of, and she'd used those capabilities to save a life when it mattered most. The emergency meeting in Hospital Administrator Dr. Robert Kane's office was scheduled for 8 a.m., less than 8 hours after Maya's life-saving surgery on Tyler Morrison. Word of the unauthorized procedure had spread through Memorial General's administrative hierarchy with the speed that characterized any event that combined medical heroics with potential legal complications. Maya arrived at Kane's office precisely on time, carrying a folder containing her military medical records, board certifications, and documentation of her surgical training that she'd retrieved from her apartment. She'd spent the early morning hours preparing for what she knew would be a thorough examination of her qualifications, her decision-making, and the circumstances that had led to her performing major surgery without proper hospital credentialing. Dr. Kane was a 20-year veteran of hospital administration, someone who'd navigated countless medical crises and understood the delicate balance between patient care and institutional liability. He was joined by head nurse Linda Carson, the hospital's chief legal counsel Sarah Martinez, and Dr. Connor Walsh, whose presence had been requested specifically to address the workplace dynamics that had contributed to the previous night's events. "Dr. Bennett," Kane began, using Maya's military title deliberately, "let's start with the basic facts. You've been employed at Memorial General for 8 months as a registered nurse, but last night you performed major surgery that saved a patient's life. I need to understand how we got from point A to point B." Maya had prepared for this conversation by organizing her thoughts in the systematic way that military training had taught her to approach complex briefings. "Dr. Kane, I joined Memorial General's nursing staff under my legal name with accurate credentials for the position I was seeking." Maya began. "My nursing license is current, my background check was thorough, and my references were legitimate. I never misrepresented my qualifications for the nursing position." Legal counsel Martinez consulted her notes before asking the next logical question. "But you didn't disclose your medical degree or your surgical training during the hiring process. Can you explain why you concealed qualifications that would have made you eligible for significantly more advanced positions?" Maya had anticipated this question and had prepared an answer that was both honest and professionally appropriate. I was transitioning from military to civilian medicine after personal losses that made it difficult for me to continue practicing. Trauma surgery, Maya said. I sought a nursing position because I wanted to continue serving patients without carrying the full responsibility of surgical decision-making. I needed time to process my military experiences before considering a return to surgery. Dr. Kane studied Maya's military records, which documented her extensive combat medical service, her board certification in trauma surgery, and the circumstances surrounding her transition to civilian life. Dr. Bennett, these records are extraordinary. Bronze Star, Purple Heart, 6 years of combat surgical experience with Special Operations Forces. You're one of the most qualified trauma surgeons who's ever worked in this hospital, even as a nurse. Maya appreciated Kane's recognition of her military service, but she was also aware that Dr. Walsh had been unusually quiet during the discussion, and his body language suggested he was preparing to voice objections to the proceedings. Dr. Kane, Walsh finally interjected, while Dr. Bennett's military service is commendable, the fact remains that she performed unauthorized surgery using hospital resources without proper credentialing. Regardless of the outcome, she violated established protocols and created liability issues for Memorial General. Maya had expected Walsh to focus on administrative technicalities rather than acknowledge the life-saving nature of her surgery, and she was prepared to address his concerns directly. Dr. Walsh, Tyler Morrison was dying, Maya said, her voice remaining professionally calm. No trauma surgeon was available. His condition was deteriorating rapidly, and I had the training necessary to save his life. I chose to act within my medical capabilities rather than let a patient die while we waited for administrative approval. Walsh's response revealed the depth of his hostility and his inability to acknowledge that Maya's medical judgment had been superior to his own. The issue isn't whether the surgery was successful, Walsh said defensively. The issue is that hospital protocols exist for patient safety, and Dr. Bennett's decision to ignore those protocols sets a dangerous precedent, regardless of her military experience. Legal counsel Martinez had been reviewing Maya's documentation during the discussion, and her assessment was both thorough and supportive. Dr. Bennett's credentials are impeccable, Martinez reported to Kane. She's board certified in trauma surgery. Her military medical training exceeds what's required for civilian practice, and her combat experience includes exactly the type of emergency procedures she performed last night. Head Nurse Carson, who'd witnessed the systematic harassment Maya had endured from Walsh, decided to address the broader context that had contributed to the previous night's crisis. Dr. Kane, I think we need to discuss Dr. Walsh's treatment of Dr. Bennett over the past several months, Carson said. I've documented multiple instances of inappropriate behavior, public criticism, and professional undermining that created a hostile work environment. Walsh's reaction was immediately defensive, but Carson continued with the kind of systematic presentation that reflected months of careful observation. Dr. Walsh consistently questioned Dr. Bennett's competence despite her excellent performance, made dismissive comments about her medical assessments, and created an atmosphere where her contributions to patient care were systematically devalued. Maya listened to Carson's presentation with mixed feelings. She appreciated the validation of her experiences, but she was also aware that the formal documentation of Walsh's harassment would have serious consequences for his career at Memorial General. Dr. Kane studied the harassment documentation while considering the broader implications of the situation. Dr. Walsh, these reports suggest a pattern of inappropriate behavior toward a colleague whose qualifications far exceeded what you understood them to be, Kane said. Can you explain your treatment of Dr. Bennett in light of what we now know about her background? Walsh's response was revealing in its combination of defensiveness and unwillingness to acknowledge wrongdoing. I maintained appropriate professional standards with all nursing staff, Walsh said. If Dr. Bennett felt criticized, Perhaps she should have been transparent about her qualifications instead of concealing them. Maya recognized that Walsh was attempting to shift responsibility for his behavior onto her decision to maintain privacy about her military background. "Dr. Walsh," Maya said calmly, "my decision to work as a nurse rather than a surgeon was personal and didn't justify months of professional harassment. My performance as a nurse was consistently excellent, regardless of my previous training." Dr. Kane was beginning to understand the complexity of the situation and the need for decisive administrative action. "Dr. Bennett, based on your credentials and last night's demonstration of your capabilities, I'm prepared to offer you a position as a trauma surgeon with full privileges at Memorial General," Kane announced. "Your military experience and surgical skills are exactly what our trauma department needs." Maya appreciated the offer, but she was also aware that accepting it would mean returning to the high-stress surgical environment she'd been trying to avoid. "Dr. Kane, I'm honored by the offer, but I need to consider whether I'm ready to return to full-time trauma surgery," Maya said. "Last night proved that I still have the skills when they're needed, but I'm not sure I'm prepared for the daily responsibilities of surgical practice." Kane nodded, understanding that Maya's transition from military to civilian medicine involved personal considerations that went beyond her technical qualifications. "Take the time you need to decide," Kane said. "Meanwhile, we need to address Dr. Walsh's behavior and determine appropriate consequences for the harassment you've documented." Walsh's face reflected the recognition that his months of dismissive treatment were about to have serious professional consequences, particularly given that they'd been directed at someone whose qualifications far exceeded his own. The investigation was revealing not just Maya's extraordinary background, but also the extent to which Walsh's behavior had created problems that extended far beyond their personal conflict into broader issues of workplace harassment and professional standards. The formal investigation into Dr. Walsh's conduct took 3 days to complete, during which time Maya continued working her regular nursing shifts while hospital. Administration conducted interviews with every staff member who'd witnessed the months of systematic harassment. What emerged was a pattern of behavior that was not only unprofessional, but had potentially compromised patient care by undermining one of the most qualified medical professionals ever to work at Memorial General. Jennifer Kim was among the first staff members interviewed by the hospital's Human Resources Department, and her testimony was both detailed and damning. Dr. Walsh's treatment of Maya was consistent and deliberate, Kim told HR Director Patricia Holmes. He questioned her competence publicly, dismissed her medical assessments, and created an atmosphere where other staff began to doubt her abilities despite clear evidence that she was exceptionally skilled. Kim provided specific examples of Walsh's behavior, including the incident with Mrs. Rodriguez where Maya's early detection of internal bleeding had saved the patient's life, only to have Walsh minimize her contribution and suggest she was creating unnecessary drama around routine cases. Maya identified a life-threatening condition that Dr. Walsh missed, Kim continued. Instead of acknowledging her excellent clinical judgment, he criticized her for overreacting. It was unprofessional and dangerous from a patient care perspective. Dr. Alex Foster's interview provided additional context about Walsh's behavior and its impact on department morale. Connor's treatment of Maya was inappropriate from the beginning, Foster told Holmes. She demonstrated exceptional competence in every situation, but he seemed determined to undermine her credibility. I tried to address it with him directly, but he was defensive and unwilling to acknowledge that his behavior was problematic. Foster also provided insight into Walsh's motivations, suggesting that his hostility toward Maya had been driven by insecurity and a need to assert dominance over someone he perceived as threatening his position within the department hierarchy. Connor seemed threatened by Maya's competence, Foster explained. She had a way of anticipating needs, handling crises, and making accurate assessments that made his own limitations more apparent. Instead of learning from her expertise, he chose to attack her credibility. The most damaging testimony came from patients who'd been treated by Maya during Walsh's harassment campaign. Several patients specifically mentioned the contrast between Maya's compassionate, competent care and Walsh's dismissive attitude toward both patients and nursing staff. Tyler Morrison, who'd recovered completely from his emergency surgery, provided a statement that highlighted the life-saving nature of Maya's intervention. "Dr. Bennett saved my life," Morrison told investigators. "The other doctors told me I would have died if she hadn't stepped in when she did. She performed surgery that no one else was qualified to do, and she did it because she cared more about saving my life than following protocol." Morrison's statement was particularly significant because it demonstrated the real-world consequences of Walsh's behavior. His systematic undermining of Maya had created an environment where her life-saving capabilities were almost prevented from being utilized when they were most needed. The investigation also revealed that Walsh had been actively discouraging other staff members from relying on Maya's assessments and recommendations, effectively sabotaging her ability to contribute to patient care at the level her qualifications warranted. Nurse David Lee testified that Walsh had explicitly told him to double-check anything Bennett suggests and had implied that Maya's medical assessments were unreliable despite consistent evidence to the contrary. Dr. Walsh created doubt about Maya's competence where none should have existed, Lee told investigators. Her clinical skills were obviously superior, but his constant criticism made some staff question their own observations about her performance. The most revealing aspect of the investigation was the discovery that Walsh had been aware of inconsistencies in Maya's background that suggested she had more medical training than she was acknowledging. But instead of addressing this professionally, he'd used it as justification for hostile behavior. Dr. Kane reviewed Walsh's personnel file and discovered notes indicating that Walsh had questioned Maya's qualifications during her probationary period, suggesting he suspected she was hiding something about her medical background. Dr. Walsh had opportunities to address his concerns about Dr. Bennett's background through proper channels, Kane told the investigation team. Instead, he chose to engage in systematic harassment that created a hostile work environment and potentially compromised patient care. The administrative review concluded that Walsh's behavior constituted workplace harassment, professional misconduct, and a violation of Memorial General standards for collaborative patient care. The consequences were swift and decisive. Walsh was summoned to Kane's office on Friday morning for a meeting that would effectively end his career at Memorial General. "Dr. Walsh," Kane began, "the investigation into your conduct has revealed a pattern of behavior that's inconsistent with our hospital's values and professional standards. Your treatment of Dr. Bennett was inappropriate, unprofessional, and potentially dangerous to patients." Kane presented Walsh with documentation of his behavior, including witness statements, patient complaints, and evidence that his harassment had created broader problems within the emergency department. "You systematically undermined a colleague whose qualifications far exceeded your own," Kane continued. "You created a hostile work environment, compromised department morale, and potentially interfered with patient care by discouraging staff from utilizing Dr. Bennett's expertise." Walsh's response was defensive and revealed his continued inability to acknowledge the severity of his behavior. "I maintained appropriate professional standards," Walsh protested. "If Dr. Bennett had been transparent about her background from the beginning, none of this would have been necessary." Kane's reply was firm and final. "Dr. Walsh, Dr. Bennett's decision to work as a nurse rather than disclose her surgical background was her personal choice and didn't justify months of harassment. Your behavior was unacceptable regardless of what you knew or didn't know about her qualifications. The consequences were comprehensive: immediate termination from Memorial General, a formal reprimand that would be reported to the state medical board, and a requirement that Walsh undergo professional conduct training before being eligible for employment at any other medical facility. Your employment at Memorial General is terminated effective immediately, Kane announced. Security will escort you from the building, and your access to hospital systems has been revoked. Walsh's downfall was complete and public. Word of his termination spread through the hospital within hours, along with the full story of Maya's military background and the heroic surgery that had saved Tyler Morrison's life. The contrast between Walsh's disgraceful exit and Maya's vindication was stark and satisfying to staff members who'd witnessed months of unprofessional behavior directed at someone who deserved their respect rather than their skepticism. Jennifer Kim summed up the sentiment of many staff members when she said, "Connor got exactly what he deserved." Maya endured months of harassment with grace and professionalism, and she saved a life despite everything he put her through. Justice was served. Maya herself felt a complex mixture of relief, vindication, and sadness about Walsh's downfall. She'd never wanted to destroy anyone's career, but she also recognized that his behavior had been unacceptable and that consequences were necessary to protect other potential victims of workplace harassment. The investigation's conclusion marked the end of a difficult chapter in Maya's civilian medical career, but it also opened new possibilities for her future at Memorial General and beyond. The truth about her background was now public. Her capabilities had been demonstrated dramatically, and her reputation had been restored after months of systematic undermining. The stage was set for Maya to decide what kind of medical career she wanted to build, now that she was free to practice at the level her qualifications warranted without having to conceal her extraordinary background and capabilities. 6 months after Tyler Morrison's life-saving surgery, Maya Bennett stood in Memorial General's newly renovated trauma surgery department, wearing surgical scrubs that bore the title Chief of Trauma Surgery embroidered beneath her name. The transformation had been gradual but profound, reflecting not just her personal journey from hidden nurse to recognized surgeon, but also the broader changes her presence had brought to the hospital's approach to emergency medicine and trauma care. Maya had ultimately accepted Dr. Kane's offer to return to surgery, but on terms that reflected her hard-won understanding of what she needed to practice medicine sustainably. She'd negotiated a position that combined surgical responsibilities with teaching duties, allowing her to train the next generation of trauma surgeons while maintaining direct patient care that honored her military commitment to service. The decision hadn't been easy. Maya had spent weeks considering whether she was ready to return to the high-stress environment of trauma surgery, with its constant reminders of combat medicine and the life-or-death decisions that had defined her military career. But Tyler Morrison's recovery and the knowledge that her skills could save lives when conventional medicine wasn't sufficient had ultimately convinced her that hiding her capabilities was neither sustainable nor ethical. Dr. Bennett called Dr. Rebecca Torres, one of the surgical residents Maya had been training. "We have a multi-trauma case coming in from a construction accident. The paramedics are reporting crush injuries and possible internal bleeding." Maya smiled at the respectful tone in Torres's voice, remembering the contrast with the dismissive treatment she'd endured from Walsh. The young resident was one of several medical personnel who'd specifically requested assignment to Maya's service after hearing about her combat medical experience and her innovative approaches to trauma surgery. "What's our ETA?" Maya asked, falling into step beside Torres as they moved toward the trauma bay that had been redesigned to incorporate lessons Maya had learned from battlefield medicine. 4 minutes out, Torres replied. "Patient is a 34-year-old male, conscious but in significant pain, vital signs stable but concerning for internal injuries." Maya nodded, automatically running through diagnostic and treatment protocols that combined her civilian medical training with techniques she'd developed during her military service. The integration of combat medicine principles into civilian trauma care had become one of her signature contributions to Memorial General's surgical program. The trauma bay they entered reflected Maya's influence on the hospital's emergency medicine protocols. Equipment was arranged for maximum efficiency during crisis situations. Surgical instruments were organized using principles Maya had learned from field hospitals, and the entire space was designed to facilitate the kind of rapid decision-making that characterized combat medicine. Jennifer Kim, who'd been promoted to senior trauma nurse, was already preparing the bay for the incoming patient. Kim had become one of Maya's closest colleagues and had specifically requested assignment to the trauma surgery department after witnessing Maya's transformation from dismissed nurse to respected surgeon. "Maya," Kim said, using the first name that reflected their evolved relationship, "I've got everything ready. Blood products standing by, surgical team on alert, and the OR prepped if we need immediate intervention." Maya appreciated Kim's thoroughness and the collaborative atmosphere that had replaced the hostile environment Walsh had created. The trauma team now functioned with the kind of mutual respect and shared purpose that Maya remembered from her military medical units. Dr. Alex Foster entered the trauma bay, carrying the patient files that would help guide their treatment decisions. Foster had become Maya's closest physician colleague and had been instrumental in supporting her transition back to surgical practice. "Maya, the construction worker's injuries sound similar to cases you handled in Afghanistan," Foster said. "If anyone can manage this kind of trauma, it's you." The patient arrived exactly on schedule, and Maya immediately recognized the type of injuries she'd encountered repeatedly during her combat deployments. The construction worker had been caught in a structural collapse that had caused crush injuries to his chest and abdomen, creating exactly the kind of complex trauma that required the integrated approach Maya had developed through years of battlefield medicine. "Let's get him stabilized and assessed," Maya announced to the trauma team, her voice carrying the calm authority that had characterized her military service. "This looks like something we can handle, but we need to work efficiently to prevent complications." What followed was a demonstration of the collaborative trauma care that Maya had implemented at Memorial General. The team worked with practiced efficiency, each member contributing their expertise, while Maya coordinated overall care using principles that combine civilian medical standards with combat-tested techniques. The surgery was successful, complex but manageable given Maya's experience with similar cases and the team's training in her innovative protocols. The construction worker was stabilized, his injuries repaired, and his prognosis excellent thanks to the rapid intervention and expert care he'd received. After the surgery, Maya found herself in her office, reviewing the case notes and reflecting on how much had changed since that night, 8 months earlier when she'd first revealed her surgical capabilities. The quiet nurse who'd endured systematic harassment was gone, replaced by a confident surgeon who commanded respect through demonstrated competence and collaborative leadership. Dr. Kane stopped by Maya's office that afternoon, carrying news that reflected the broader impact of her presence at Memorial General. "Maya, I wanted to let you know that our trauma department success rates have improved by 30% since you joined the surgical staff," Kane reported. "We're receiving referrals from hospitals throughout the region, and our reputation for handling complex trauma cases has never been stronger." Maya appreciated the recognition, but she was most proud of the cultural changes she'd helped implement. The trauma department now functioned with the kind of mutual respect and collaborative problem-solving that characterized the best military medical units she'd served with. "The statistics are gratifying," Maya replied, "but I'm most proud of the team we've built. Everyone contributes their expertise, everyone's input is valued, and we've created an environment where patient care comes first, regardless of hierarchies or egos." Kane nodded, understanding that Maya's influence extended far beyond her individual surgical skills to encompass broader improvements in hospital culture and patient care standards. "You've transformed this department, Maya," The way you've integrated combat medicine principles with civilian trauma care, the training programs you've developed, the collaborative approach you've implemented, it's exactly what we needed. That evening, Maya sat in her apartment, looking at the framed photograph of Tyler Morrison with his family that he'd given her after his complete recovery. The young construction worker had returned to work, married his longtime girlfriend, and started a family, all because Maya had been willing to step forward when her skills were needed most. Maya's military medical kit remained in her closet, but it was no longer hidden in shame or kept as a reminder of a life she was trying to forget. Instead, it represented tools and knowledge that she'd learned to integrate constructively into her civilian medical practice, honoring her military service while building something new and meaningful. Her phone buzzed with a text from Jennifer Kim. "Maya, thank you for everything you've taught us. Working with you has made me a better nurse and a better person." Maya smiled, recognizing that her journey from hidden nurse to respected surgeon had ultimately been about more than personal vindication. She'd learned to use her extraordinary background to lift up others, to create environments where everyone could contribute their best work, and to save lives using every skill she'd acquired through years of service and sacrifice. The transformation was complete. Maya Bennett had found a way to honor her military service while building a civilian medical career that reflected her values, utilized her capabilities, and created positive change for patients and colleagues alike. She was no longer running from her identity as a combat surgeon. She was building on it in ways that made everyone around her better. The ghost nurse was gone, replaced by a leader whose quiet strength and extraordinary competence commanded respect not through intimidation or hierarchy, but through demonstrated excellence and collaborative spirit. Maya had finally found her place in civilian medicine, and Memorial General was better for her presence. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.